You are entering the conference now.
This is Keith Carey in Sherman Oaks, California, and just wanted to welcome each and every one of you tonight. But we've got people listening and calling in, watching our webinar from all around the world. We've got a very special guest with us tonight, and we're going to be introducing him in a couple of minutes. First and foremost, Nyloxin, division of Nutripharma Corporation, which is a 12-year-old publicly traded company based in Coral Springs, Florida. Nutripharma Corporation operates as a biotechnology company specializing in the acquisition, licensing, and commercialization of pharmaceutical products and technologies for the management of neurological disorders, cancer, autoimmune, and infectious diseases. The company also manufactures through its subsidiary over-the-counter OTC drug product Nyloxin for the treatment of moderate to severe chronic pain. Rick Dyke is the CEO of Nutripharma Corporation. He's got over 25 years of experience in biotechnology research and development. He's an author, public speaker, lecturer on biosciences. He also formulated the product called Cobroxin, now under the brand name of Nyloxin. We're currently developing breakthrough drugs with MS, multiple sclerosis, HIV, and rheumatoid arthritis. Nyloxin comes in regular strength and extra strength formula. It comes in roll-on, oral spray, and topical gel. It's an all-natural ingredient. It's cobra venom. You heard me right. It's cobra venom. It's diluted 10,000 times. As a matter of fact, it's safe for everyone to use. 92% of the people that use this product correctly get a positive result with the product. It's got 46 human clinical trials on the active ingredient, which is the cobra venom, and it is registered with the FDA as a homeopathic drug. Again, it's safe to use. Your children can use it. Elderly folks can use it. I use it all the time. I'm out there playing sports all the time. I'm 55. My knees are not 22, I should say. They are 55, and sometimes they feel like they're 77-year-old knees. I'm out there doing racket sports on hardwood floors. I also have a personal trainer that I do CrossFit training with 3 times a week. And so I'm jumping over benches. I'm jumping up and down, doing squats, and doing all kinds of stuff in the gym. About the last 2.5 to 3 years, I've been on Motrin, and I just recently had a surgery, and when they did the blood test on me, the doctors came into the room and they said, you've got some issues with your blood. Your blood is, your platelets are low, and your blood is very thin. I can almost assure you that that was from the Motrin, because that has a habit of doing that to people that overuse Motrin, the Tylenol 3, the Advil, and thank God I never had to get on any of the opiates. 100 million adult Americans that are suffering from pain, chronic pain. And you get rid of your Motrin, your Advil, your Tylenol out of your medicine cabinet, and you replace it with our Nyloxin product. Put one of the sprays, one of the gels, one of the roll-ons in your medicine cabinet from now on. I think you'd be doing yourself and your family a great service. Again, the product is registered with the FDA as a homeopathic drug, and it's safe to use by all. I'd like to introduce tonight my special guest, Dr. David Markowitz. He's a traditionally trained allopathic pediatrician in Maine who's practiced 18 years of an integrative approach to health and wellness. He's trained in general pediatric oncology. He's used natural products in his practice and his family for over 20 years and has a very touching testimonial as to how Nyloxin has impacted his life. And I'm going to go ahead and call David here. David, are you on the line with us?
I sure am. Can you hear me okay?
Go ahead, David, loud and clear.
Okay, thank you, pal. Well, honestly, guys, it's an honor to be on the phone. Today, it's amazing what a week difference can make in my life and the life of my beautiful wife. A week ago, my wife awakened after several years of intermittent right hip arthritic pain, awakened with acute, very severe right hip pain. It was very concerning to me. This is my best friend in life, and just the idea of seeing her in this much discomfort really troubled me deeply. Luckily, within 24 hours, I made contact with Keith, and he introduced me to Nyloxin. He was kind enough to get me in touch with Rick, the CEO of Nutripharm, and we had a long discussion. Thankfully, he was very kind enough to have an hour or so discussion with me. And that, together with a little bit of research, convinced me that this is indeed something that we should try. I went ahead and received both the Nyloxin oral as well as the Nyloxin gel. And luckily, by Friday afternoon, we received our first product. Up until the time that we received that product, my wife, who is extraordinarily tolerant of pain, was wincing and at times even seeing stars from the pain, which obviously to me was very concerning. Normally, Dawn, my wife, is very circumspect about the natural products that I bring into the house, and normally she has me try them for a month or two before she'll even touch them. This time, because of the pain that she was enduring, she basically said, "Just bring it on. Let's go for this." So late Friday afternoon, she took her first dose. She repeated it Friday night, went on a 4-time-a-day, every 4-hour schedule for Saturday and Sunday. Saturday and Sunday, she still suffered a fair amount of discomfort, to the point of stopping when we normally take our dogs for long walks. She stopped several times because of the discomfort. And Sunday we discussed at length, she's an interior designer, we discussed at length whether her busy day schedule on Monday was going to happen without some additional support by me. She awakened Monday morning, and I swear as God is my witness, and I don't use this very frequently, even though I'm very deeply involved in the natural approach to health and wellness. Literally, I felt like a miracle had happened. Monday morning, she awakened feeling good. An hour and a half later, prior to her leaving the house at 6:30 in the morning, she continued to feel good. And 4 hours later, when I text her asking her how she was feeling and reminding her about her dose of both oral as well as the gel, she said, "I'm still feeling good." And 4 hours later, she said the same, and 4 hours later, she said the same. So after a 12 to 15-hour, very long day involving a lot of physical exercise and hauling her materials back and forth upstairs, she continued to feel good. And this is a woman not 24 hours before, 48, 72 hours before, could hardly make it down the block. This was an incredible godsend to us and to my beautiful wife. That was Monday. Tuesday, she awakened feeling good. Tuesday night, she reported feeling great. Wednesday, again the same, and today, Thursday, again the same. She still feels occasional twinges, but it's not painful twinges, and it doesn't interfere with the quality of her life. So there's no question that in my mind and in her mind, and she is much more skeptical than I about natural products, in her mind, more importantly than even mine, and I have a decent background, obviously, in the use of natural health and wellness approaches to challenges. This product has made an enormous difference in her life, and I consider it an incredible gift. And I don't use this word very, very lightly, but it was truly miraculous for her. And I thank Keith and I thank the company for making this product available to us. So that's, again, my story, Rick and Keith, and I stick to it, and I'm delighted to be able to share it with people.
Excellent. Okay. I've got a quick question for you before we move on. What would you tell other doctors who are being approached by Nyloxin that may be skeptical or may, kind of poo-poo the whole idea of the product we have here with Nyloxin? What would your suggestion be to them?
Well, having been in the natural health and wellness field for quite a while, I realize how often close-minded and how busy allopathic physicians are, to the point where even when I, in the past with other products, have recommended them researching the product before they make a determination about its use. And I understand that. But I also understand, and I've actually shared this with Keith in the past, that pain in any form, particularly in a chronic form, particularly for children, but it obviously applies to all of us in our 30s, 40s, 50s, 60s, and 70s. Pain can really be a debilitating aspect of our life. Not only does it affect our physicality, but it also affects our spirituality and our emotional approach to life on a day-by-day basis. And particularly with severe chronic pain, that really starts to define us as being a person who suffers. And then we in turn turn to our allopathic doctors, who then recommend anything ranging from ibuprofen in any form to Aleve, to any of the other prescription products. And what we end up doing is we turn the control of our lives over to the pain and or to the treatment of pain. The thing that really impressed me, and it impressed my wife as well, is the fact that here we have a natural product that we control, and in our control with this natural product with minimal, if any, side effects. And we don't have to worry about liver problems or kidney problems, or in the case of Keith, bone marrow problems. In the case of the heavier medications, a dependence upon those medications, we don't have to worry about any of those things. And at least in my research so far, and in my talking with Rick at length, Rick Deich, 90+% of people respond well to this preparation if used in a responsible, recommended fashion, which means that we turn that control of that pain over back to the individual, and in the case of an allopathic physician, the patient. And the patient then can start to control that part of their life which has previously controlled them. And that has an enormous effect, not only on a physical basis, but also on a spiritual and emotional basis. So the impact of this product, and I can tell you from my own personal experience in the last week, actually in the last, I guess, 6 days, the fact that Dawn is feeling so much better and feels so much better about even taking our dogs down the block for a walk. She actually mentioned to me earlier how troubled she was about the idea that one of the things that she loves to do is to take our beloved dogs for long walks. It may not sound like much, but to an individual it can mean an enormous amount. And the fact that 4 or 5 days ago, she couldn't do that without anticipating pain, now she can do that. That's incredibly freeing to the spirit, to the emotions, to the physicality of any one individual. So that control, the fact that one can self-control one's own life, and something that has impacted somebody sometimes in a week, as in Dawn's case, or 2 years, as in Dawn's case, or for many people, decades, is incredibly impactful. And I think that's something that all of us need to remember as we approach sharing this product with other people. So that's a long answer to a short question, Keith, but there you have it.
Really thrilled to hear that Dawn has experienced some great results with our product in such a short period of time. And again, no side effects, guys. This is no NSAIDs. It's non-narcotic, non-steroidal, anti-inflammatory, non-addictive product called Nyloxin. And it's really turning a lot of people's eyeballs towards this company and hearts towards this company, because we're able to go out there and actually share such an amazing product and help people. Like you said, the pain has been controlling these people's lives, and they can take their lives back under control. That's such a powerful statement. Dr. David, thank you so much for being a part of this call tonight.